particular segment. And we want to talk about the issue that has been on the minds and on the tongues of many Kenyans, all to do with mental health. This topic right now is no longer a taboo, and many of us are joining the conversation, but many still have questions, especially around the high prevalence rate of suicide cases in the country. Just recently, we saw an article highlight the alarm as 483 suicide cases hit the nation in just a span of 3 months, perhaps putting sharp focus into an issue that hasn't just risen recently, it has been with us. So let's just get to talk about this in totality, some of the issues that you can use to approach issues to do with psychology. And right now I'm joined by Dr. Margaret Makanyengo, who is a consultant psychiatrist, joining us from our I&M studios. Thank you so much for your time and good morning. I'd like to begin on the latest, even as you get to introduce yourself. How exactly should one deal with rejection, economic hardships? Because these are some of the things that have been attributed to the rise in suicide cases in the country. Talk to us, Margaret.
Thank you. Good morning, everybody. I'm happy to be here in the studio. I'm a consultant psychiatrist working at Oasis Health Specialty Hospital that is on Peponi Road. I've been working for a period of about 30 years as a psychiatrist, consultant psychiatrist. And in my observation, all this starts in the foundation. Rejection is one of the factors that actually contribute to suicide, in that contributing to depression. Rejection is one of the factors that one will experience from the family level, yeah? It depends on the parenting, it depends on the upbringing, and basically you find nowadays we are not providing the proper parenting that we are supposed to provide. A lot of parents are poor role models. There's a lot of divorce, there's a lot of violence. And again, if you look at that, you look at unemployment and poverty as factors, and drinking and alcoholism as escape routes, so that you find at the family level, the kind of care that a child is supposed to have, they do not get the kind of proper care and upbringing. They do not even have the kind of values that they need in growing up. So you find the result is that children feel rejected, individuals feel rejected. So as one grows up and engages in relationships, you find it affects you. You become vulnerable. And you get vulnerable to depression, and depression is a precursor of suicide.
Okay, that's well noted, Dr. Ari. And I think these are some of the issues we really need to look at. But at the end of the day, societal values really play a big part in this rise in mental health cases and suicide cases in the country. But where did the rain start beating us? Because it's not just in the 21st century that rejection became the way of norm. How did we stop dealing with rejection in a way that is okay in society, then took extreme measures of perhaps taking one's life? Where exactly did we go wrong?
It's hard to tell, but I would believe that, we've gravitated away from our traditional norms. Most of the traditional norms, the way we grew up in society, that is long ago. The society had measures and had systems in place where individuals were able to get guidance. Individuals were able to actually have direction from relatives, from extended family, from society. And unfortunately, as where we are right now, it has all disintegrated. The nuclear families are the ones that actually stand alone. And so when something is wrong with your nuclear family, once something is dysfunctional in the nuclear family, then the result is there's no one else to turn to. Whereas in the past, our uncles, our aunties were mothers and fathers, and the grandparents had their valuable role in guiding the children on issues that the parents could not address. So breakdown of these norms, these valuable traditions, is one of the contributing factor to where we are right now. So nobody can really give you a direction in terms of values and direction. So our foundation is a bit shaky right now.
Okay, a shaky foundation might definitely be an area of concern, Dr. Margaret, but let's talk about stress, because I mean, if you are working, perhaps not in Nairobi or even in the CBD, you might get stressed. But what's the difference between stress and depression? And when exactly do you know when to ask for help? And if someone isn't really responsive, when do you know they need help, especially when they don't ask for it?
Yeah, that's quite a challenge. Well, the difference between stress and depression, right now, everybody gets stressed. In fact, stress is the way we cope with changes around us. It's the way our body responds to changes around us to enable us to function and to cope, yeah? Mild stress, no stress is a problem. No stress, because if you need some stress to get up in the morning and go to work. So no stress is not good, yeah, because then you'll just sit like a bag of potatoes, yeah. But moderate stress is good because it enables us to get up and do stuff. But when we have excessive stress and cumulative stress, that now leads to the risk of depression and mental illness. And that is stress that is overwhelming, that makes us not able to cope. And so that can now lead to depression, among other forms of mental disorders. Now, depression is one of the commonest mental disorders in the world, I would say. In a study, they found about 32% of people were depressed. Like in any outpatient, you go to any hospital, you'll find about 32% of clients sitting in a general outpatient facility actually suffering from depression. But I believe the prevalence could be a lot higher in the general public. And so when one has depression, you can tell. You yourself, you probably tell you feel less motivated to do things. You have loss of interest in things. You're not able to cope. You're not able to concentrate. You feel very sad most of the time. And you have a stream of negative thoughts passing through your mind. So, and lethargy, poor appetite is a series of symptoms that make you a different person from who you really are. Now, the people around you will be able to notice this because there's a change in character. You find somebody who used to be jovial, somebody who used to talk a lot, no longer is able to talk, or is withdrawn, keeping to themselves, or irritable. You find they're not able, a small comment annoys somebody so much that that is it looks irrational, yeah. And on top of that, you find they're not able to function well in the office. Even in school, we have children who get depression. The teachers would notice the child is not performing well, just like the employers would notice that the individual is not performing so well at the workplace. Together with that, there's forgetfulness, among other things. Now, a portion of people with depression end up with suicidal ideas and will try to commit suicide. So I think as neighbors, or what we need to do is look at our colleagues, and if you notice a change in character, if you notice somebody withdrawn, not himself, or drinking excessively, generally a change in the character of the individual, you need to be concerned. Those are early signs, I believe, of depression, including violence. So, and that cascades down to schools, because I feel that children are also getting depressed and suicidal, and we have a problem in that teachers need to be able to notice when a child has a problem, because sometimes when a child is withdrawn and not performing well, they get caned, they get beaten. So as a result, children are also committing suicide, you know. So basically, those are some of the early warning signs that we need to look for. And we have a role to play, you know. We are our brother's keeper. When you see somebody change like that, talk to them, get close to them, try to hear what the problem is. And if you find that they're irrational, you cannot communicate, you can refer them for help.
Okay, well noted, Dr. Margaret. Allow us to bring into the conversation Dan Mugera, who's a counseling psychologist, just joining us via way of phone. And let's start from the top with you, Dan. Thanks for your time. When we talk about mental health, there might be triggers that might push someone to take such extreme measures as suicide. And especially when we're talking about young individuals, those who are still in learning institutions, these triggers might come in different ways. It might be as simple as having the same teacher who disciplines you when you're wrong and who you might have a negative perception towards, being the same person you push to when you ask for counseling advice. So how exactly do we balance this, even as you highlight some of the triggers that might push people into such extremes? Talk to us, Dan. Dan, can you hear me? Dan Mugera? Okay, there seems to be a challenge right there, but we'll definitely establish connection with Dan Mugera, who's a counseling psychologist. But back to Dr. Margaret, I think I'll pose the same question, because you talked about there are various cadres. Teachers might be dealing with students who might be facing a couple of issues to do with mental health. So in such institutions where the teacher is the disciplinarian and might wear the hat of the counselor as well, how do you approach this, especially when you're dealing with young, delicate minds? Is this an issue you think should be highlighted?
It should really be highlighted. Institutions, we need to have teachers. Yes, they are disciplinarians, but they need to be fully equipped in psychology and understand the psychology of the people they are dealing with, so that you need to know when do you engage a disciplinarian mode and when do you engage a counseling mode. Unfortunately, we don't have enough counseling psychologists in schools, but we do need counseling psychologists in schools. We need all our teachers to be trained in counseling, to be able to identify even better ways to discipline. Discipline doesn't necessarily mean caning, you know. Talking is perhaps a very good way, but also creating forums in institutions where people can engage, people can express themselves, people can ventilate, children can ventilate, some kind of health clubs, and those will enable children to be able to talk about issues, because that will ventilate, as well as basically the problem again in institutions like schools is the pressure is so much. You wake up at 4 a.m., you have to be in class by 5 a.m., then go for breakfast, and the program is like a robotic program where there's no time to do exercise, no time. You know, we need a wellness program within schools, just like wellness program within our institutions. So, and wellness involves spirituality, games, debate, you know, work, you know, and a variety of things that people can do, and people to talk to. There are two schools that I would say I really admired, because my children went to these schools. They had tutors who were like parents to each student, so that, and this tutor is not necessarily the direct teacher, yeah? So these tutors were like parents, like counselors, so that if a child had any issue, and personal issue, they would go to these tutors, and the tutors would address it. I think that model was quite good, and I'm hoping that most schools would adopt it. So Yeah, I think those are just some of the ways that we need to mitigate these problems.
Okay, well noted, Dr. Margaret. Thanks for that contribution. I understand we have Dan Mogera on the line now. As I mentioned earlier, he's a counseling psychologist. Dan, I hope you can hear me. Let's talk about the affected group in society, those with mental health issues. Highlight some of the long and short-term effects, especially within the society, as we make mental health a more relatable conversation, less of a taboo and more of something we really need to highlight as a society. What's your take on this? Perhaps even as you highlight the triggers that one should look out for.
Thank you. Thank you very much. I hope you can hear me right now.
Right, so.
Yeah, and thank you for the contribution that have already been made by Dr. Margaret right there. So looking at the triggers, the different triggers, and life changes, is one of the triggers. Sometimes people go through things in life, and then there are abrupt changes or even anticipated changes that once somebody is in those particular changes, he is not able to cope. And so prolonged inability to cope with some of the life changes could indeed trigger depression, but also feeling stressed and overwhelmed. That feeling of helplessness is one of the triggers towards depression. Recently, I was invited to speak in one of the universities, and the guiding and counseling department officers highlighted to me that in 3 months, they had lost 2 students. And both of them came from particular department. Last week, I had a chat with one of my mechanics, and he told me another university student who lives in their neighborhood had committed suicide. And they were supposed to take him to one side of Kenya to go and bury the person. So feeling stressed and overwhelmed, that feeling of helplessness definitely can trigger somebody if they don't find help. In fact, study shows evidence that many depressed people experience hormone changes due to stress. So when you have prolonged stress, as Dr. Margaret has already said, this and nothing is done about it, definitely could lead to depression. But one of the things that sometimes we don't talk about it a lot is that newly diagnosed medical condition or illnesses could trigger depression, because somebody here just went to the hospital and news is broken to them that they have this and this terminal illness and that they have short time to live. This could lead to shock and despair, and somebody could begin to move towards depression. But again, also sometimes while somebody is in it, side effects of medicine could also begin to affect somebody negatively and bringing depressive conditions. But we all know the hard economic times right now, and financial issues, job losses, all these are triggers that could lead people into terrible, terrible situations and also depression. Poor eating habits and even substance abuse can lead people to this particular condition. So people should check and develop awareness, be able to accept the situation, stop worrying a lot, and also look for someone they can talk to, especially an expert or even a genuine friend who is willing to listen.
Right, and especially the exclusivity aspect when someone looks out for help is quite important, and that's why counselors are regarded as individuals quite important in society. Dr. Margaret, I mean, we've talked about stress, anxiety, depression, but as I was going through some of the issues around mental health, I came across personality disorder. Perhaps break it down for us in a way we get to understand, where it doesn't mean that you're fundamentally different from everyone else or anyone else. It just means you might need extra support. So paint a picture of what a personality disorder might entail and how this might also contribute to mental health issues if it's not addressed in the right way.
Yeah, I think as individuals, we need to try to understand each other. Some people have different personalities, and by and large, we are not all the same. So you find that we need to understand each other and adapt to try to deal with individuals as they are. But there are individuals who have a personality that is a problematic personality. And this is a challenge even to us mental health workers, because you cannot treat personality disorder. You cannot give medication. Even the counseling may help, but personality disorder is just a character or a personality in an individual that when you say disorder, this person has a problem coping with people, has a problem coping even with his family. Like one of the commonest personality disorders you probably hear about now is narcissistic personality, where you find an individual is so self-centered, so arrogant, hurts people around them, and it seems to be commoner in men. Yeah, and you find that the wives cannot cope, the children cannot cope, and the gentleman goes to work, has his family and all that, but mistreats, it's cruel, yeah? There's emotional abuse, sometimes even physical abuse, because that's his personality. No matter how much you try to counsel and help this individual, you find they don't change. And that is, let me tell you, that those are some of the challenging cases for us. And I'm sure even psychologists can attest to that, that counseling such individuals, they'll come, they'll be remorseful, they say, oh no, I'm not gonna do that again, may my wife come back to my house again, but you find it still continues, the arrogance, the cruelty, and all that. So I think the best thing in such cases is try as much as possible to understand the person and cope with them, but it's not very easy changing a personality disorder.
Okay.
But for mental illnesses, we treat them. Yes.
Okay, we'll get to talk about the treatment, whether the counseling way or the medical way, the drugs way is the best. But Dan Mogera, let's talk about the current state we are in. And you mentioned something quite critical, the economic turmoil due to COVID-19. We have people working from home. Isolation is a norm right now. So how exactly do you help from home, perhaps due to financial constraints, one way or the other, or you are at a distance, you can't access this particular person due to the current times we live in? How do you offer assistance? Because the lockdowns have sort of cut out effects to help avenues. Talk to us about this.
I know that the remote, as we call it, or hybrid workplace nowadays, where people are working from home, has resulted into a lot of issues. And that alone is a trigger to some extent, because a lot of people are isolated. You can imagine people who were used to come to a place of work, mingle with other colleagues, be able to interact, and just being around people, it's very, very good, and it can, lessen the effect of stress that could lead to depression. And now this person is remotely. So as counselors, we really encourage people to even find help remotely. And nowadays, it's not a must for people to really come to our offices for us to help them. We could have a Zoom session with them, or even using any other virtual way in how we could connect, even phone, and we are able to talk and enable these people to find help. So things have changed, and people can even call. There are different numbers that Red Cross has provided. People can call and even find help when they're feeling symptoms of too much stress, or even feeling like they are depressed. And in the place where people can get opportunity to really get out of their isolated zone and be able to find help sitting down with a friend over coffee, or even visiting a counselor in their office, that could also help them to another level.
Okay, well noted, Dan. And perhaps one other issue, because we're out here encouraging people to seek help when they're in such a position. Is this the current norm? Why do perhaps men mostly tend to lock their troubles and not really share? Is it due to the numbers of counseling psychologists in the country, or it's perhaps back to the individual himself and or herself, down to the issues of whether they want to open up or not? How do you look at this?
It's true that even right now, we were talking the other day with fellow counselors, and we realized majority of the counselors are actual women, and we have very few men, or should I say few, not very, but few men who are in the counseling profession. But again, also, when you come to men, you find that statistics show that majority of people who commit suicide or are highly depressed are men. And this is because men like to lock in their issues. They don't easily share their problem. This is, one, the way men are wired, but two, culture has played a big role in making men behave the way they behave, because culture stigmatizes men who talk about what they are going through. Culture stigmatizes men who cry. Culture stigmatizes men who have the inability to deal with their own psychological and emotional needs. And so because of that, men find it very difficult for them to share information with other men, or even to share information with a counselor, with an expert. They feel their ego is going to be crushed. And so something needs to be done to allow men to create a safe environment for men to have honest conversations with fellow men, or even to have conversation with their life partners, maybe spouses, so that they may be able to find help. This inability to communicate what you're feeling will definitely affect you, and at the end of the day, it will crush you. And you might find yourself isolated and beginning to contemplate suicide, while it's something that you could have found help if you would have acted quick enough and spoke to the right people.
Okay, well noted. Dr. Margaret, as we talk about seeking help, are drugs or therapy, which one of it is the best way of dealing with mental health conditions in order to improve someone's mental health being? Are there other alternatives in terms of perhaps diet, sleep, that one can look to, even as you add your voice to the better option, perhaps, between drugs or therapy?
And normally, first and foremost, listening, counseling is extremely important. But even it starts at the community. We are our brother's keeper. When you find somebody is not himself, we ourselves should approach the person and listen, yeah? Just listen to what their problem is and see where we can support them, yeah? And normally, if you find they're not able to cope and the condition is extreme and they have changed their character, they're at risk of harming themselves or harming people, then, or even as an individual who's not able to cope, like not able to sleep, is feeling sad and needs someone to talk to, you can refer them to a facility, you can refer them to counselors. And normally what we do is we do an assessment. Like, let me say, what we do in our facility, you do an assessment and see, is this a patient who needs just counseling, or is this a patient who needs counseling and medication, or both, yeah? And is this a patient who can be followed as an outpatient or inpatient? So in that assessment, we come up with a diagnosis, and then we do the recommendation. Some patients, I would say quite a number, need just basically counseling. And there are different types of therapies, you know, trauma-focused cognitive therapy for those who've been abused or exposed to severe trauma with post-traumatic stress disorder. Then there's just the supportive therapy. Then there are a variety of therapies that you give as a counselor. Then you find if an individual is so sick that the therapy cannot work, like for example, psychotic behavior, violence, talking to himself, threatening to jump through the window to kill himself, we normally admit and give medication. The medication is extremely effective and life-saving in such cases. Normally within 3 to 4 days, somebody settles down. The person, for example, who was hallucinating and hearing voices, no longer hears voices, or they will subside. Basically, the medication works on the transmitters, neurotransmitters, that are imbalanced, you know, and they are so imbalanced that the medication balances these neurotransmitters. And even as they get their medication, we still engage a counselor. If it's someone with, say, alcohol abuse, with mental illness, we also do addiction counseling, among others. We also have spiritual therapists. We have a pastor who actually comes in and helps in inner healing, because you find a lot of this pain and mental illnesses comes from deep suffering, deep pain that the individual experienced as a child, as they grew up in their marriages. It left some psychological wounds. So the inner healing of the spiritual path is extremely therapeutic, as well as support groups, occupational therapy, among others. So we are talking of holistic care. And even after that holistic care, when they go home, follow-up is extremely important. Yeah.
Okay, just a follow-up question, and quite briefly, we ever so often hear of the word bipolar disorder thrown about. Is there a connection to the mental well-being of an individual?
Yeah, bipolar disorder is one of the many psychiatric conditions. Bipolar disorder is a mood disorder. There's a group of mood disorders that includes depression, where mostly one gets depressed. Bipolar, you can be manic, extremely happy and excited and talking a lot. The same day you crash into a depressive episode. So you swing, yeah? So in bipolar disorders, they tend to swing, so we give them mood stabilizers that actually stabilize the transmitters so that they don't need to swing from hyper. Because being hyper or excessively happy and active is also a problem, because such individuals will wake up early, will not eat enough, we are likely to be too excited, and their judgment is impaired, yeah? Then we also have schizophrenia. That's also another common condition, or a mixture of schizophrenia and affective disorder, schizoaffective. All respond to medication. Now, those patients need long-term medication. So even then, they still need counseling on the importance of taking their medication and wellness, yeah? So it's quite a wide area and a variety of conditions that we deal with.
Right, well noted, Dr. Margaret. Dan Mugera, as we finalize, I mean, the best suggestion to give someone who is facing mental health problems is just to ask them to seek appropriate help. But even as you do that, how exactly do you speak to someone with mental health problems like depression or anxiety? I know trivializing the condition will make matters worse. So how do you approach it before you get to the point of asking for help and seeking assistance? A fast responder type of way.
Thank you very much. Majority of people who are going through mental health problems, they are in denial. Most of them will not accept that they actually have a problem. And especially in this side of the world where seeing a counselor looks like a problem, you know, where somebody feels like, I have gotten to the end of myself for me to really seek help, could really hamper that capacity for people to seek for help. So as Dr. Margaret has alluded, we need to be our brothers and sisters keeper. And you begin to simply talk to a person and encouraging them that it's okay to seek for help. It's okay for them to find a mental health practitioner who could help them be able to recover from the situation that they are in. But it's important for the people who are going through this situation to develop awareness and be able to accept the situation that they are in, and to also understand that help is available. Mental health is no longer something that we can hide from. It's no longer something that we can escape from. It is something that we need to confront it head on, find help, and be able to recover. And there are genuine experts today in Kenya who could help one recover from that particular stage. So I will really, really encourage people to simply develop that awareness. And where somebody hasn't developed that awareness and accepting the situation, family members, colleagues should be able to check on that particular person and encourage them to look for help.
Well noted, and that's a proper footnote. Awareness is quite critical as we combat this particular scourge, because common issues, common mental health issues like depression and anxiety affect 1 in every 4 people. So it's about time we make this a common conversation. But many thanks for your contribution, Dr. Margaret Makanyengo, who is a consultant psychiatrist, a seasoned one, as we had her mention, as well as Dan Mugera, who's not new to the show, a counseling psychologist. We appreciate your input right here, even as we push for mental health not to become a taboo, as it's commonly referred to, but an issue that is seen with the utmost importance it deserves. We appreciate that. Allow us to take a short break. We'll be back with much more as we reach the final end of the show. Stay with us.